So in the next scenario, it's again role play, but this time with an angry patient. So we are going to read off the scenario as follows. A patient who has been waiting for a long time in A&E due to abdominal pain is angry about the length of their wait and is demanding that they be seen earlier. They so far have normal blood tests and their heart rate, blood pressure, and other basic observations have all been normal and stable as well. You are asked as one of the A&E doctors to go and talk to the patients. So in this scenario, the patient is going to be upset about the length of their stay and about the fact that they're waiting so long. The scenario is clearly telling you that the patient is clinically not urgently unwell. Quite often in A&E, you have patients who are very unwell and need to be seen to urgently, and patients who are less unwell and should be waiting longer to see a doctor. In this scenario, you need to make sure that this patient is aware that you can see that they are distressed about the fact that they've been waiting so long, but they need it clarifying to them about why they've been waiting so long over other patients. So let's jump into the scenario. Hi, I'm Alex. I'm one of the doctors working in A&E. I'm sorry about the length that you've had to wait to get seen by one of the doctors, and we're working as quickly as we can to get round to seeing all the patients as quickly as possible. I've been told by some of the other staff members that you've come in with abdominal pain and that so far your blood tests have all come back normal and your other basic observations, including your heart rate, blood pressure, and oxygen levels and breathing rate, are all normal and within a normal range. And quite often in A&E, there are lots of patients all needing to be seen at the same time and inadequate levels of staff to go through and see all the patients as quickly as we would like to. We apologise for the fact that you're having to wait, but that is essentially why the wait has been as long as it has been. I can see that this is very distressing for you and that it's very frustrating to have this problem and not get it fixed at a speed that you would like, but we are trying our best to get round to seeing you, and you will be seen in due course. Obviously in the real thing, you'll have an actor doing some back and forth. The other important part here is to not let any of the patient's anger or a well-acted sort of aggression throw you off. Sometimes you do get stations where that is used by the actors. The key to doing that well, or the key to handling that well, is to listen to their concerns and to calmly retain them and calmly listen to them, and depending on what they say, just sort of re-emphasize the information that we just previously said and try to answer any concerns that they have. Obviously, as a student who hasn't started medical school or working as a doctor, you aren't quite yet used to speaking to angry patients or handling their concerns. So the best way to get ready for this sort of scenario is to practice with your friends and family. You want them to practice as honestly and as accurately as possible. Sometimes you'll sort of, obviously you know that they're your friend and or family and you're not taking them quite as seriously. So do emphasize that they do some very good acting, that they do try and push your buttons and sort of ask you very aggressive questions in a sort of challenging way. And as you practice that and you practice getting those challenging questions, you'll become more comfortable sort of listening to the patient, showing them that you are addressing their concerns as best you can, and then you won't be as thrown off when you get situations like that in the MMI stations. The really crucial part to the preparation for the angry patient role-playing station is just to have lots of practice with realistic scenarios where someone has acted as a very angry and aggressive patient towards you, and you need to try your best to treat the situation realistically so that you are responding to the conversation as you would if you were working as a doctor or as a medical student.